to keep people safe at home wherever they may be. We're also very grateful and excited to have the sponsor support from Medibank and Smith & Nephew for this week, our week, for nurses where you need them. I just wanted to do a bit of housekeeping before we get started. Today's presentation will be recorded and it will be made available in Neo for the Nursing and Community COI. We have a chat box today, so we did ask people to send through their questions on registration, and we have got quite a large number of people at the webinar today. So could I ask you to please keep your microphones on mute and use the chat box to answer any questions, and we'll get through them as best we can today. We'll have the panel presenting to us today, and then I will pose some questions to you. And I just wanted to let you know that there is an ACN CPD certificate that will be emailed to all attendees today. The Nursing in the Community of Interest has a membership of over 1,000 nurses from across Australia that encompasses a broad and diverse set of skills and roles to provide care to our community in a wide variety of clinical settings. Nurses in the community recognise and address barriers and challenges in our health system that are impacting on achieving health and wellbeing for all of our communities on a daily basis. I'd like to just introduce you briefly to our leadership team who work hard behind the scenes to bring you this week, all of us with busy day jobs, but because we believe in the importance of nursing in the community and we believe in you. So I'm Kitty Hutchison, I'm the chair of the Community of Interest. We have Alan Merritt who'll be supporting us with questions today. We also have Pemi Allam, our communications coordinator, is helping behind the scenes with it as well. At present, we have a open position for the Secretariat, and if we inspire you today, have a think about joining us. Nursing in the Community Week aims to raise awareness of how nurses can support our community to stay safe at home, wherever that may be. So today we're going to have the opportunity to hear and consider the Royal Commission into Aged Care. What were the outcomes? The final report endorsed a rights-based approach, placing the needs and preferences of the older person at the centre of the aged care system. So what does that mean for us as nurses working in the community, and how we as a profession can be influential in ensuring we keep our health systems accountable to the reform that supports delivery of care that meets that increasingly complex and diverse needs of the older person in Australia. We've brought together a panel today of experts that have a diversity of expertise and skill sets in aged care. And it's a panel that reflects us and the diversity of the roles that we play. So we have people with an understanding of overarching policy and system perspectives. We have someone with the management skills and in the coordination of care right at the coalface. And we also have someone that looks at the delivery of care and the impacts that the Royal Commission recommendations will have. So I'm really excited to welcome Susan, Kay, Danielle and Fleur to our panel today. So each of them is going to give us their perspectives of the recommendations and how they see it impacting on nursing and the nursing role into the future. We'll then open up for a panel Q&A for the rest of the session. So the first person I'd like to introduce is Susan Amerson. So Susan is the chair of the Australian College of Nurses. I hope you got the document we sent through a link for the aged care solution. So ACN pulled an expert advisory group together earlier this year to look at the recommendations that came from the Royal Commission and come up with some recommendations for action from an Australian College of Nurses perspective. Susan is also had a lot of work. She's been involved in work with the National Aged Care Alliance, with the Australian Digital Health Agency, and she also is the Deputy Chair of the Palliative Care for South Australia. Susan has worked as a ministerial appointed member of the Aged Care Financing Authority in the past, and has been involved in the development, assessment, classification of the funding model to underpin single in-home program. So I'd like to welcome Susan.
Thank you so much, Kitty, for that introduction. I wasn't actually the chair, but I'm very happy to be acknowledged as one of 26 members of the advisory group committee and want to acknowledge the other members. I have a list here, but I don't want to, and I'd like to acknowledge them all, but you can find it on ACN's website. And I do apologise, technology is wonderful, isn't it? Some printing I started just before we logged on has just decided to happen. So apologies for noise in the background. Thank you for the opportunity to talk today to your community of interest and for your generous welcome. So I think that you were sent a link probably of a document that was produced by the expert advisory group called Perspectives Brief, Aged Care Reform, Recommendations to Action. This document looks like this. It's available and outlines specifically the College of Nursing's recommendations in response to the findings of the Aged Care Royal Commission. But I'll just go back a step and remind us all that the Royal Commission occurred over the last 2 years. The final report was handed down on February the 26th in 2021. The government chose to receive that report and decided to publish that on March the 1st, and then also announced that they would respond to most of the recommendations as part of the budget process, which occurred in May. Now, if you're really interested in the Commission and the details and all of the hundreds of submissions that were made, you can order yourself a copy. It's 10 volumes and it weighs a lot, so be prepared. There is a final report, which is a single document, which is volume 1, which is a summary of all the recommendations, of which there are 146. So it's a really comprehensive report that summarises the major findings of the Commission, that acknowledges all the contributions from people, from carers, consumers, family members, nurses, health professionals, an enormously diverse group of people. And of course, we're here today to think about the impact of the recommendations on nursing and what that's going to look like for us moving forward. We've only got 5 minutes, and so I don't want to take up a lot of time going into the detail, but I think there are some major themes that come out. For me, it's more of a personal reflection, and then we can talk a little bit more about the college's brief. I think some of the major things are recognising that people want to age at home and in the community and stay there for as long as possible. So, and that ageing occurs everywhere, that it's a continuum, that it's not a location-based thing, it's happening to us all, and that society expects to be able to stay at home longer. As a result of that, there's going to be some need for significant structural change, namely increases in aged care packages, and I know that Kay is going to talk about that some more, so that there'll be dollars for care that will support service providers and people to actually make that care happen and to allow people to stay at home as long as possible. There was also recognition that we need to significantly improve the way we provide residential aged care, that there'll always be a place for residential aged care. It's a valuable and important part of the system, but particularly for people who are frail and very complex and perhaps receiving end-of-life care. So we're seeing a sort of a condensing and a complexity increase in the types of residential care. There was also a call for different models. We need to do it better, not just in terms of the clinical care and the type of support and services, the way we provide interprofessional practice, but also what that care looks like, and moving away from, and I know Rodney Gillick and others on the committee feel very strongly that there's many, many ways we can consider doing this differently and better. And another tenet of the recommendations is reducing the ACAR. So we will actually have a freeing up of the system, and the consumer is going to be voting with their feet, and they're going to be looking for a quality and type of care that suits them. And it's going to be much more consumer-centred, much more consumer-directed. I think the other thing that came out really, really strongly, which is a gap, which is particularly relevant for the community of interest that we're meeting together today about, is transitions of care by older people themselves. So the importance of doing better and supporting older people in moving from home to hospital and back again, to avoiding hospital, to providing more complex care at home, and then potentially moving from hospital to the nursing home as well, transition care, moving home again, the increasing importance of respite. So it was really, that really strongly spoke to me, and was some relief to hear that there was recognition that there are gaps in the way we do that, we can do it a lot better. And for that to happen, it's going to be extremely important for federal government to work with jurisdictions, and for us as nurses, that means nurses in community practice, you know, in rural and remote areas, doing outreach nursing. It means nurses in aged care, in palliative care, and really how we can improve quality of the experience of the older person themselves, but and make sure that they getting consistency of care, avoiding hospital, going home faster, all of those things that we know about. So I think the final thing I'll say then, which I'm reminded about, is the increasing and incredibly important part that digital health is going to play moving forward. And I know you've got a special talk about that in coming weeks, but I have to advocate for the My Health Record and the benefit of that to older people as they move across settings and take their medical records with them, and can use their My Health Record to advocate for themselves, or where they can't, we'll have that valuable information there. So I will point to the perspectives brief from the college, which talks about improvements in workforce, in education, in remuneration, and in professional support for nurses working in aged care. It's a very detailed report that outlines the needs in 3 different phases, but I think I'll leave it to Kay to actually talk to some of the more specific workforce aspects of that expert advisory group paper that's been provided to government. So Kitty, I will now hand to Kay, if that's okay. I hope I was okay for time.
That's lovely. Thank you very much, Susan. I really appreciate it. I'd like to introduce Kay Richards. So Kay is actually a fellow chair of one of the communities of interest for healthy ageing, but Kay's experience also includes positions at both provider and peak body level. And I'm really interested to hear from Kay because she participated in developing the latest aged care quality standards. So her perspective is quite different to my own, which is from a clinical perspective. And she's a current board director for 2 aged care services and is seeing some of the issues that are coming forward from the recommendations. So welcome to the panel, Kay.
Hi everyone. Is the audio okay, Kitty? I was having problems and I'm doing this through my phone. Great. Good. Technology is wonderful. Hi everyone. I'm really honoured to be able to present today. As chair of the Healthy Ageing Community of Interest, it's really interesting to think that we're ageing right across our lifespan, and when we talk about healthy ageing, it really is the full gamut of our lifespan, but we often only think of the end, the bit that I'm getting towards closer and closer as we speak. But really it is about our whole lifespan, and we really want to make sure that people are being able to take advantage and be the best in the best health that they can. But my focus is on the older person, and being in aged care for an awful long time now, and it's great to be able to have a look at some of the things that are important, I think, to providers of care, i.e. the members of this community of interest, and the members and fellows of the College of Nursing. So as chair of the Healthy Ageing Community of Interest, but also as a board member for 2 aged care services, I think there are 3 main areas that I really want to focus on tonight, specifically for home care, in the home care and community care sectors. And those three things are about access for the consumer and therefore the workforce to sustain a safe quality care delivery. Also around clinical governance and what it is that nurses can do to improve clinical governance, and also about the safety and quality of care that we deliver, specifically around dementia care and palliative care. So Susan referred to the Royal Commission, and as you say, there was 146 recommendations, and I'm certainly not going to go into most of those tonight. But in response to some of those issues around access and workforce that I've just highlighted, the government has promised that there's going to be an increase in 80,000 places by 2022-23, and that's going to bring a total of 275 packages available to the community by June 23. That's fantastic from a consumer point of view. There'll be more access to more packages, but it also therefore puts a strain on our workforce, because where are we getting the workforce to be able to deliver the care that is required by these people that do want to stay at home, but their care needs are increasing as they stay home for longer. By the time that those packages are in place, a new home care program is due to commence with a single assessment workforce. Now, currently we have ACATs that do assessment for a place, whether it's in home care, res care, or other settings. We have assessments for funding, and we have assessments for care. We assess till the cows come home, and what the government is trying to do is consolidate that assessment process, which will be external to providers. But again, where are we getting the workforce that's actually going to be doing that? And so that's going to be an interesting space to watch. There'll be face-to-face services at the local level, so linking Service Australia and the My Aged Care together, which is hopefully going to improve access to information for the consumer. But we know that currently there's about 1.2 million people that receive some form of aged service delivery currently, and around about 170,000 people are receiving home care. So we start, as I've just said, that's going to increase significantly over time. We know that the government wants to ensure that the consumer has the full value for money that they're paid for their packages. So the consumer is going to be much more defining in what they want and really having a downward pressure on fees that the providers might charge. Excuse me. The Aged Care Quality and Safety Commission is going to receive more funding, and this is the big stick approach to increase compliance, which is going to include assurance reviews for home care providers. And they're going to enforce a new code of conduct and a nationally consistent pre-employment screening process, which will result in a single register of workers. Now, that's not necessarily what the college was advocating for more broadly, or other bodies, but hopefully that will assist providers in being able to select especially aged care workers that have had some form of pre-employment screening. So what are some of the incentives to attract and retain staff? And that's around, for example, RNs, there'll be more training available for places for RNs and for care workers, and certainly more money to be able to provide that training. There'll be a home care workforce support program, and that's aiming to attract a further 18,000 care workers for home care. Where are those people coming from? I will keep saying that over and over again. But some of the good stuff, though, there's some incentive payments for RNs who stay with the same provider for 2 years. So there's some good things about making sure that we retain our staff. But what's important to me is not just the number of people that we have employed, but that we're attracting and retaining staff that have the right attitude and attributes to work in aged care. So they're people that are compassionate, that show resilience, that have a genuine enjoyment of working with the older person, that have the flexibility to be able to work across the sectors and with different types of people, but also have that empathy that's needed. These people are very special, and employers need to make sure that they value their staff and that they listen to their staff. And I think that that's really important, that we as care providers have a great opportunity, but also a responsibility to make sure that we're caring for our staff so that they can care for the people that we're caring for. Clinical governance is, the headline story at the moment, especially in aged care and around board governance. And general governance from a board perspective has been ever so important now, but clinical governance specifically, I think, was highlighted by the Royal Commission. So we have to make sure that we've got a system in place where there's shared responsibility between boards, the managers and clinicians. And that shared responsibility is a two-way street, I guess. We've got to make sure that as registered nurses, we are taking up that responsibility and we are holding up our side of the bargain, as well as providers are holding up their side of the bargain. There needs to be robust reporting and monitoring systems in place, and that's important because we need to know what's happening within our services. There has to be a focus on the consumer. That's got to be open and transparent. I'm fortunate. I work in places where that's a norm, but I know that that's not always the case, and we need to make sure that as registered nurses we speak up to make sure that there is open and transparency in the care that we give. But that means that staff have to actively participate, and that's not about just coming to work and doing your job. It's actually about speaking up, about being part of the system and part of the processes that happen. Because what we want to do is make sure that we've got continuous quality improvement flourishing within our organisation. Just lastly, and I'm aware of the time, safety and quality was very strong in the recommendations, and it specifically, talked about, especially in residential services, the food that we deliver, the infection control processes, etc., etc. But two of the main areas that were really highlighted was dementia care and palliative care, and that doesn't matter in what setting we're in. People are wanting and needing that care around dementia care and palliative care much more strongly today than ever before. So there will be an expansion of the National Dementia Support Program and additional outreach capacity for the National Dementia Helpline. So obviously that means more money going towards those areas. More dementia training throughout the aged care sector, which I don't think we can ever be overtrained in how we help people with dementia. Restraint-free and dementia-friendly building practices. And I know one of the boards that I sit on, we're just in the process of doing a new build. And the first thing was to actually go to Dementia Australia and get their opinions on what the building should look like. And that was of absolute, gold value. So there is a need for more formal training in palliative care. And I just, on behalf of the college, reviewed some new palliative care standards for generalist palliative care services. So they're coming out shortly, and they're looking really good. But we also need to make sure that there's dementia care and palliative care in the curriculums that we offer for not only for for registered nurses, but also for aged care workers. And the thing that I really don't like, but can understand why, is a star rating system for by 2022, which will give the consumer, I guess, more choice and hopefully more understanding between the different providers. So there's a lot of things that I might leave until the end of the session around what does that mean for you as the nurse providing care in the community? Where is your power base in all of this? You know, what control do you have over our workforce and clinical governance and training? And you know, how do you make a difference to the care that you are delivering? So I'll hold those questions until the end because I think probably they'll come to us rather than me ask you guys. So thanks, Kitty, and over to you.
Sorry about that. Thank you very much, Kay. I'd like to introduce Danielle Knowles, who's the Executive Manager of Aged Care for Regal Home Health. She manages the home care package program and the private sector care for Regal. And I thought it was really important for us to hear from the perspective of someone who is coordinating the nurses working in this space. Regal Home Care has looked after its nurses over the years very well and values their nurses. So I was really interested for us to hear the perspectives of someone trying to coordinate the clinicians in that space. So thank you, Danielle.
Hi, everybody. I guess, yeah, so my perspective is going to be more, I guess, a reflective discussion on what I've learned over the last few years. So my background has always been acute nursing. I was cardiac clinical nurse specialist, nurse unit manager, those sort of things in a hospital up until 3 years ago when I made the move into community and aged care. It was a pretty big culture shock and a very steep learning curve. I guess in the hospital, I never really thought about what happened next. Once the patients had left my care, what happens? I guess I assumed that they could access any support they needed. So until I actually started working in the system with aged care, I had no idea. And I would guess a lot of nurses in the acute system have the same situation. My current role as the executive manager for Regal, it does involve seeing our aged care clients, our regulatory compliance, and I manage a team of registered nurses who are employed as case managers for our home care package programme. Aged care is not always seen as an attractive area of nursing. It's hard work, it's frustrating, but to be honest, I've found it's some of the most rewarding work I've ever done. Helping someone stay at home has afforded me some of the most beautiful stories that I've had in my career to date. Working in aged care at the moment, as much as the Royal Commission has got some great steps that we're going to take, right now we face barriers. As a nurse, we're built to want to support and advocate and achieve greater health outcomes for our patients. Unfortunately, as we all know, we're working with a system that's flawed, and I feel the most important thing is for the nurses out there to have a solid knowledge of that system is the best way for us to achieve those great outcomes for our patients. Nurses and their unique skills set are vital for achieving good outcomes. They need to be involved in the decision making, the planning and the evaluation to the system, but they also need to in turn understand how that's going to affect them and their patients or consumers in practice. The aged care system in Australia is complex, to say the least. It's taken me probably, the 3 years to have the knowledge and confidence that I have, and to be honest, it's pretty much been self-directed. So you can imagine being a patient or a family member trying to understand the system. How does it work? What are they entitled to? It's overwhelming, and I feel like the nurses have a great role in helping them with that and a responsibility to help guide them. I'm very lucky to work for a provider in Regal that respects and understands the importance of a nurse and how invaluable their experience and skills are. Regal's got nursing in its DNA. It was founded by a nurse 55 years ago, and even to this day, it has nurses in their most senior roles across the organisation, from operations to aged care to obviously our clinical governance. At Regal, we decided when we created our home care package programme to go with a model of care that supported nurses and their skill set. It's a model that I'm really proud of, and we decided to have all of our case managers be registered nurses. Other providers we work with, I guess they broker our nurses to do clinical assessments and give clinical oversight. We decided we would do that ourselves. A nurse's ability to assess, plan, deliver and evaluate is essential in aged care. Having nurses as their case managers uses their skills to monitor changes in both health and well-being. We build relationships with them and their families. We can liaise with other health professionals, for GPs, hospitals, and we can look at them holistically. I get multiple requests from the team, from the field nurses, and they've identified that their patients need more support or that one of the carers is struggling. They want extra services, but I don't think they really understand what's involved with that request. I would love to be able to say yes to every single one that I get, but unfortunately, especially at the moment, we are limited and we're bound to the parameters of each funding body. Currently, as most of you will know, the home care package waiting list can be up to 18 months for a level 4 package. Level 4 is the highest level, which normally means they've got high needs and they need care now. Unfortunately, I've seen way too often that by the time they actually get the package, it's either they've already made the transition to permanent residential care or they've passed away. Even with a level 4 package as it stands at the moment, the care we can deliver is limited. A level 4 package, for anybody who doesn't know, attracts around $52,000 a year. But when that's broken down after the fees, it still only affords around 12 to 14 hours of support to that consumer. And that's support from a support worker, not a registered nurse. Funding for nurses has been reduced massively in the community over time. Politicians obviously deciding who and what skill set should be delivering the care. I'm just glad that we still have our nurses in the field overseeing all of our consumers. Until the system is changed and we get some of these recommendations going, I believe that nurses identifying the patient's needs early is the key to success. Educating the nurses on how, and educating them and the family on what they're entitled to, getting your patient's details in the system, starting the process is the only way we can get ahead. To enable nurses to do this, they need the education on different funding streams. They need to understand what's available and how hard it is or how easy it is to get. Knowing who my aged care are, what they can assist you with, understanding the process of how to organise an aged care assessment. There's many nurses in the community that wouldn't even know where to start. Making sure we don't overpromise, making sure that the goals we set are realistic and they're achievable. Knowing the importance of involving other health professionals and knowing which funding stream is the most useful for their patient and helping the families understand that there is support available. I truly believe that nurses are equipped with such expert skills in assessment and care planning and their holistic approach. They really know their patients. They're in a perfect position to make a difference and ensure that their patients can stay at home safely for as long as possible. Even in a system that's broken at present, the nurses are there and they can, we can bridge the gap for now. That's all I was going to say.
Oh, thank you so much, Danielle. I'm a bit like, that's a bit close to home on some of that. That's, that's beautiful. That is to the heart. And I think, all of us out here, we all know how valuable nurses are in this system. And today is about us thinking about how can we be heard? How can we be heard? Because we have so much to give. Thank you so much. The next person I'd like to introduce is Fleur. Fleur is a nurse practitioner for wound management and a director at Wound Solutions Australia. Fleur's been brought to us by our sponsor, Smith & Nephew, and in one of the recommendations to actions, one of the priorities for the Australian College of Nurses was about bringing that evidence base to our home care. And there's no other area in nursing, I think, that that nurses can clearly see the evidence that we bring to our practice as it is with wound care. And we know with our as people get older, their skin integrity is at risk, and it's really important that we have nurses like Fleur working with us. So thank you for coming, Fleur, and we're really interested to hear your thoughts about this. Just before you start though, we've got a little message from Smith & Nephew.
Thank you so much. There's some slides coming, so if we can just move through the slides, please. Lovely, and just next slide, please. Lovely. So, look, good evening, and thank you so much for the opportunity to present tonight at the webinar. It's a real privilege to be here, and also wanting to thank Smith & Nephew for the sponsoring of me being here. Now, up until a couple of years ago, the bulk of my career, like yours, Danielle, was in the acute setting as both a clinical nurse consultant and as a nurse practitioner in wound management. But my recent transition to the community nursing space has been both exciting and rewarding. Now, the delivery of quality, person-centred, evidence-based and safe care to older people living at home is integral to community nursing. As people are living in their homes for longer, often with deteriorating health conditions, their risk of pressure injury and incontinence-associated dermatitis increases. And this is one of the reasons why I wanted to speak about the prevention and management of these conditions tonight. And Kitty, as you said, the frailty, skin frailty in the older adult is really something that as community nurses or as us working in the community need to focus on and work together with the client to promote skin integrity, to prevent pressure injuries and to prevent incontinence associated dermatitis. Next slide, please. And next slide, please. So I just want to tell you a little bit about who I am. So I'm a registered nurse since 1985 and has been a nurse practitioner in wound management since 2013. Now, I'm passionate about working with people living with wounds to improve their quality of life. I'm passionate about enabling others to deliver quality, evidence-informed wound management. I'm also passionate about skiing, but that's another story. And passionate about pressure injury and IAD prevention and management in the community. I currently work for a nursing provider in southwestern Sydney who's committed to the delivery of quality, evidence-informed wound management. And aside from my clinical role there, one of the really, really important things that I do, and I think it's very important for supporting evidence-based delivery of care, is the mentoring and the support to all of the registered nurses and the enrolled nurses in that space to ensure that they too can deliver evidence-informed care and deliver high quality and safe care at those times. And I see that as an absolutely integral part of my job. We'll stay on this slide, please. Now, it's really timely, isn't it, that this presentation has coincided with Wound Awareness Week. We know that every year over 420,000 people suffer in Australia from chronic wounds, and that costs the healthcare system over $3 billion. And many of those 420,000 people are your clients, are your patients, are the people that in the community you're looking after and partnering with day in, day out to help heal or promote wound healing for that cohort. Next slide, please. And as we're talking about the Royal Commission, we know that some of the recommendations that have come from the Royal Commission really focus in on wound management and focusing on pressure injury risk reduction and continence care. So as was mentioned in earlier presentations, the final report includes over 146, 148 recommendations. And I really see this as our opportunity to drive the delivery of evidence-based in-home care in relation to pressure injury management, in relation to good skincare management, in relation to continence management and the prevention of complications around that. And I see that we can all partner in that space. Next slide, please. And we know with any change and any reform, it comes with challenges and obstacles that we need to face and we need to overcome, we need to recognise. So it is important that we acknowledge these as we move forward and implement and promote some of the changes that are coming our way. Next slide, please. And when it comes to pressure injury management, when it comes to incontinence-associated dermatitis, we have to hand evidence-informed guidelines and best practice statements that can help us develop our own policies and guidelines and protocols in our organisations to ensure that our nurses are delivering evidence-based care with the best available evidence. And these include the 2019 International Guidelines, the Pressure Injury Guidelines, and the best practice principles in relation to incontinence-associated dermatitis. And there is a reference link at the end of this presentation as well. Next slide, please. So what is the problem? In terms of incontinence-associated dermatitis and pressure injury, some of the problems are the difficulty in differentiating between pressure injury and incontinence-associated dermatitis, the lack of clinical knowledge around incontinence-associated dermatitis, a lack of knowledge around appropriate IAD prevention strategies, a lack of access to appropriate pressure injury prevention equipment in the community, and a lack of funding. Now, in my clinical experience, I've seen a lack of awareness or knowledge around the differentiating between pressure injuries and IADs. And this can directly impact the type of care that is being implemented to the client with a skin condition. So it is so important that we do get it right. And with an increasing move to supporting people in their own home, community nurses, we will continue to play an important role in the prevention and management of these conditions. Next slide, please. So when we differentiate the two, so essentially we know that the IAD is a type of irritant contact dermatitis that is found in people with fecal and/or urinary incontinence, whereas a pressure injury is defined as a localised damage to the skin and/or underlying tissue as a result of pressure in combination with shear. Pressure injuries usually occur on a bony prominence, but they may also be related to a medical device or other object. And that's particularly timely in these days with the COVID response and pressure injuries occurring with related medical devices as well. Next slide, please. So there are a lot of systems around and a lot of assistance around to help us work out the differentiating between the two and why they cause. Essentially, if we do not have incontinence, we do not have incontinence-associated dermatitis. And it's a really important distinction that clinicians need to be very comfortable making. When we think about incontinence-associated dermatitis, we're thinking of the cause being moisture. Whereas if it's pressure, we're thinking of the cause obviously being pressure-related in those scenarios. The location differs with a pressure injury, bony prominence, with IAD, your perineal area. The depth, usually IAD is superficial, whereas a pressure injury can be from superficial to deep. The tissue colours can alter with usually IAD being a pink to red, And your pressure injuries can be the whole spectrum there, from pink right through to black and necrotic. And the edge shapes are different as well, aren't they? Often with IAD, you've got a diffuse, wandering, irregular edge, where pressure injuries usually are a defined edge. And that is often when we're looking at the differentiating between IAD and, say, a stage 1 and a stage 2 pressure injury is where the challenges are. And that's why, as nurses working there in community settings, in aged care settings, we need to be really comfortable with being able to make that clinical assessment, make those clinical judgments, and ensure that that information is based on the best available evidence as well. Now, if you're seeing a resident, a client, someone there in the community, and the etiology of that redness or erythema is not clear in the initial phases, implement strategies to combat both of those scenarios as well. And that's an important consideration. Next slide, please. So the key interventions in the prevention and management of IAD. And again, this is the important differentiation. If we've got the diagnosis or we understand the underlying etiology, we're going to put in the right strategies for those residents and those people living in the community. If possible, we manage the incontinence, we identify and treat the reversible causes. We work with the client to implement a structured skin care regime that protects the skin that may be exposed to urine and faeces. We ensure that the pads that they're using contain superabsorbent polymers. We encourage the use of skin cleansers. We ensure prompt, gentle cleaning of the skin to remove irritants. We protect the skin to minimise exposure to irritants and frictions. And if, despite the introduction of evidence-informed activities, if nothing changes, we refer on or we get assistance. We don't just keep doing what we're doing without assessing and reassessing in those scenarios. And again, there are a lot of different things. Next slide, please. Thank you. Different products. These are just some examples of some of the products or the interventions you can put in place or be put in place depending on the severity of the IAD that's being managed, so that we can put in those structured skincare regimes right from the very beginning of someone that's at risk through to someone that has quite extensive IAD and get some good outcomes because we're really having an evidence-informed approach there. Next slide, please. When we look at those key interventions for pressure injury management, they're different. Although there's some that are the same, there's those big differences, isn't there? If it's pressure related, we really need to consider the mobility, the pressure reduction. We need to review and correct nutritional deficiencies if possible. We need to encourage and promote repositioning, pressure redistribution and mobilisation. We need to implement offloading strategies. We need to assess the need for and implement appropriate pressure redistribution equipment as soon as we can when it's been identified as being a requirement for that particular person. We need to implement appropriate wound care based on comprehensive wound assessments and a holistic assessment. And again, if we're not getting outcomes, despite the application of evidence-informed care, we need to refer on so that we can ensure that we are doing the most appropriate care for that person while they're remaining in the home. We might be thinking about using prophylactic dressings, for example, in terms of there's a lot of work now done that prophylactic dressings may be assistance in preventing pressure injuries, whether or not it's in the acute setting or the community setting. And there are documents around that can support this, not only the guidelines, the 2019 guidelines, but some earlier consensus documents as well that you can refer to help support the building of your own policy documents to assist your nurses in applying, again, that evidence-informed care. Next slide, please. And again, sorry, the next slide after that one as well, please. Again, there's a range of products that are available, whether or not it's available from Smith & Nephew or a lot of your other industry partners. Have a look at what's in the literature and then have a look at what you might need to implement pressure injury prevention strategies for your cohort as well. Next slide, please. Oh, there's one that was missing. There was my thank you slide, and it was really, there it is. Thank you very much. There are opportunities ahead for all of us, aren't there? Now, I think in closing, we really need to understand and grasp those opportunities ahead, not only for the prevention and management of things like IAD or pressure injuries in our cohort, but really as nurses to be at the forefront of change, to be at the forefront of ensuring that the care that we are delivering to people living in the community is evidence informed and the best evidence available. So thank you so much for the opportunity to join this panel tonight.
Thanks, Fleur. I think, you know, the clinician in all of us is always interested to step forward and see, you know, where things are going with that in wound care. And as I said earlier, it is one of those areas where we're bringing the evidence-based practice, and I think it is a really important thing for nurses to be thinking about in relation to home care, delivery of care in the home. We are a bit short on time, but I have some questions that I would like to pose to the panel. And the first question that I think is actually really applicable to all four of you, and I'm really interested to hear what your thoughts are in relation to this. So Kay and Susan were talking a little bit about, and probably Kay more, about personal care workers are clearly going to be part of the community home-based aged care service delivery. Actually, was there another slide that we could put forward that just had those three, the three priority areas for? Oh, it's okay. So personal care work is clearly going to be a key part of the community home-based aged care service delivery. So where do you see, all of the panel members, because you would all have a thought about this, is what do you see as the nurse's role in that team-based approach? Nursing, I feel, is so important in the whole healthcare team because we have that ability to look at someone holistically and see all the issues impacting on them. So if we're going to have to be bringing more and more healthcare workers into the team, what is the strength or what's the most important part of the nurse's role when we're looking at having that increase in the personal care worker base? Kay, do you want to start, because it does sort of touch on your space first?
I think audio okay, Kitty?
Yes, great.
Right. I think it's about how is the registered nurse supporting good clinical governance within their organisation. So we want to make sure that not only is the nurse basing their care plans on evidence and good current evidence, but also making sure that they can translate that into the how and the what and the why of the care delivery that the aged care worker is going to undertake. I've worked in places where an aged care worker has simply got a list of tasks to do, and by what time that they have to do it, what responsibility is there for that person? What job satisfaction is there if all they are doing is making sure that they get jobs done by certain times of the day? So the role of the registered nurse is not only to assess well and to plan well, but also to be able to identify what it is that the care worker can do and how they can do it, and then make sure that there's good supervision to be able to evaluate that care delivery.
Thanks, Kay. Susan, from your perspective, if you were sitting on a board and they were considering who was going to be ensuring that personal care workers were going to be doing their work well, what would you hope to be able to say to the board in regards to the registered nurse workforce of that organisation?
Yeah, thanks, Kitty. Oh, there's lots. I think that good systems and processes for bringing up the voice of the registered nurse to the board through good reporting. Certainly as part of the Royal Commission, we know that evidence, we've talked about evidence and the data that informs how we're achieving our service delivery, the quality of it, and its impact on resident or client or community-based person outcomes, we will have mandated clinical indicators. So I think it's really important to understand that, well, the board will ask for, but also that nurses know that what they do every day is valued, is important, and will need to be increasingly more transparent and made aware to boards. I would also say that the board would be expecting good systems and processes in place for the sort of holistic care that Danielle talked to, that registered nurses can't do this on our own, that we want interprofessional practice, we want to work with others, we need care workers, we need diversity in our workforce, and so having good policies, procedures, systems and processes that break down those complex tasks into meaningful language to make sure that care workers can provide delegated service and support to people in the community. Not everybody wants a medical model. We need to be thinking, and nurses of course provide holistic care, so it's not all about the clinical focus, but we recognise that we're not going to be, you know, the services provided not diagnostically driven necessarily, that the person that we're providing support to wants that support in a way that's meaningful to them, and that we're part of their life often as a care worker in the community. So the board, I think, would be looking for good education, induction, orientation, ongoing support for the workers to make sure that they are very clear on what their role is, how the organisation will support them in incident reporting and in open and transparent disclosure if something goes wrong, and that the major goal is to make sure the client has the best care they can possibly have, and that we support development of relationship, professional relationship, obviously with care workers. So
thank you. Yeah,
thank you.
I think that's great. Danielle, is there anything you'd like to add that you would like to see to help support the nurses, support the growing workforce of personal carers?
To be honest, I agree with both what Kay and Susan said. It comes down to sort of those systems and processes, the education of both the nurses and the people that will be doing the personal care, the healthcare workers. Consistent, transparent communication, really sort of checking in and making sure that everybody's happy, not just the consumer, but the staff as well, that it's a good fit, that it's not I guess a cookie cutter approach, that you're finding the right person who's really going to make a difference to that individual in their home. They're inviting them into their home. It's not a hospital, it's their home. So you need to make sure that works. That would be my take.
Thanks, Danielle. And Flo, did you have any thoughts about how nurses can support the care workers? Because you talked in your presentation about, you know, what it is we see, but the nurses aren't always there to see it, are they?
Absolutely, and that's why the education needs to go across, you know, across the whole gamut. So care workers, because they are doing so much of that personal care, need to be very confident in being able to recognise that something's not quite right. And whether or not, I think scope of practice needs to be acknowledged here, and that ability that a care worker and nurses can work very closely as a team, because basically we're all wanting to get the best outcome for the client. And yes, we do have potentially different roles that we play, but I see that education and different strands of education going across the board, so that the care worker actually has the confidence and the skills to be able to provide the best care that they can within what is defined as their scope of practice as well, and the registered nurses are there to support that. I mean, we need a range of different clinicians or different people delivering different levels of care to the people living or staying at home.
Yeah. Well, that really is, we've run out of time today, but I think that touches a really important point, is that, you know, that nurses have so much to offer. As a profession, we have so much to offer in the changes that are the future of aged care in Australia. And I'd like to think that, you know, we could keep the conversation going about how can we impact and influence the changes in the system as they go ahead, and whether it's talking to people people in the tea room talking to other health professionals or some of the other workers that we're working with, or whether it is sitting, more nurses sitting at the table, influencing how the board sees the holistic, the view of the nurse. So I want to thank you all so very, very much. I know some of you are thinking, how am I going to fit into this story? But I think it's really important that we hear the whole, the holistic view of what's going on as nurses and think about, how we're going to move forward with that. I'd like to thank Regal, ACNA, Medibank and Smith & Nephew for their support of our first webinar, and I would ask you to join us over the next 3 weeks as we explore how nurses in the community recognise and address the challenges and barriers in our health system that are impacting on people achieving good health outcomes in our communities. Next Thursday at 5 o'clock, we'll be talking to some health professionals working around vaccination of our most vulnerable communities in Vaccination Outside the Box. Digital health, I'm really looking forward to that because I am a bit of a dinosaur. I had a bit of issues with IT today as it was, so I'm a bit fearful and I need to step forward with courage. And then during Community Nurses Week, we'll be having hopefully a great session talking about leadership, because there is no healthcare without nurses. No healthcare future without nurses, and we need to keep nurses where you need them at whatever level of work that we're working with. So please share your thoughts on the social media campaign and keep sharing the message about nurses as you need them as we move into Nursing in the Community Week for 2021. Thank you everybody for attending.
Thank you.
Thank you.
Thank you, Kitty. Thanks, everybody.
You can stop the video now.
Well
Thanks,
done.
Kitty.
Thank you so much.